Minister of Public Health, Social Development and Labor, the Honorable Richard Panafleck, the Aspen Medical International team, Dr. Kirash Murkia, MD, MBA, FACS, Trauma and Critical Care Surgeon from Las Vegas, working with the AMI team, Dr. Andrew Walker, MD, MBA, and the Executive Chairman and Co-Founder of AMI, Ms. Kimberly Millican, Project Manager of the AMI team. Online viewers and radio listeners via State Martin Gov Radio 107.9 FM and respective radio stations island-wide. I'm Relika Roach of the Department of Communication, and on behalf of the Minister of Public Health, Social Development and Labor, the Honorable Richard Panafleck, I welcome you to this national briefing with regards to the current impact of COVID-19 and moving forward together. For more on this subject, I would like to invite the Minister of Public Health, Social Development and Labor, the Honorable Richard Panafleck, to address you. Minister Panafleck, you have the virtual floor.
Thank you, Mrs. Roach. Members of the media, my esteemed colleagues and members of the community who are listening to this national briefing via radio or viewing or via social media, good afternoon. As of August 16, the Ministry of VSA was informed that we are currently at 193 active cases and 107 persons who has recuperated so far. As we continue to observe an increase in the amount of active COVID-19 cases, government is urging all members of the community to actively do their part by following the mandatory regulations implemented in order to flatten the curve and reduce further spread of the virus on St. Martin. I would like to remind all that decreasing the spike in positive cases is dependent on the behavior of the members of the community. I will continue to stress the importance of wearing your mask, properly covering your mouth and nose, practice social distancing of 2 meters, avoid social gatherings, and wash and sanitize your hands frequently. In a continued effort to control the spread of the virus, government will continue to monitor the statistics and implement measures we see fit to flatten the curve and reduce the spike in positive cases. If you have been exposed to someone with a virus or experience flu-like symptoms, please remain at home and contact your family doctor immediately for next steps. To further elaborate on the current trend of COVID-19, I would hereby like to introduce the Aspen Medical International team that is here with us by the St. Martin Medical Center and helping the St. Martin Medical Center staff and team to deal with the COVID situation that St. Martin is encountering right now. I would like to thank them for the dedication, and I would like to ask and pass the word to Dr. Kirash for his introduction.
Thank you again, Minister, and thank you again, the government of San Martin, to have us on this national briefing. Again, I'm Kirash Murkia. I'm one of the surgical critical care physicians working currently with AMI, and we have been here since April 8 and caring for COVID-19 patients. Our patients we take care of are mostly critically ill patients who come in with multiple diseases and profound pneumonia with COVID-19 virus, and we care for them. And the good news is that so far we were able to make these patients better, and we have had a surge of few increasing numbers of COVID-19 over the past 2-3 weeks at San Martin Medical Center as well as on the island. And we're the main team taking care of all these patients. And as Minister Panafleck mentioned, there have been 193 recently diagnosed COVID-19 patients. And out of those 193 patients or recently diagnosed people with COVID-19, only very, very few, a handful of them have been admitted to the hospital, and we have been caring for them. The good news is that majority of those patients we have taken care of are doing better. We have been sending few of them home, and they have been also being sent out of the ICU to lower care facilities. So I want to make sure that the community understands that COVID-19 is not a death sentence. If you do feel the symptoms, and the symptoms are as follows: you have headache, cough, fever, productive cough, any aches or muscle aches, any diarrhea, even nausea, vomiting, and you feel that you do not feel yourself, please call your doctor. Your doctor will decide if he or she will need to either have you come to the emergency room, or they will call the CPS, which is the Community Protective Services, and their number is 914. And I would encourage you to follow the instructions of your doctor as well as the CPS personnel who are very well trained to take care of this. They will come to your residence, they will come to your house. They may or may not do their swab test to find out if you are COVID positive. I get a lot of questions. What if I am COVID positive? What will happen next? COVID positive doesn't mean that you will be very sick. You may be one of those people, which is the majority of COVID positive patients, who have mild flu-like symptoms, that maybe just headache, maybe just nausea, maybe just headache with cough and sore throat. So if you do have those with fever, just control your fever with paracetamol, as well as take care of your nausea with anti-nausea medications, but also try to hydrate yourself. Make sure you call one of your family members if you live alone. Have them come take care of you. They can make you soup. They can give you juice, water, and make sure that you're hydrated well. But if you do not have the opportunity to take care of yourself and you're dehydrated, please call your doctor. Make sure that they understand they need to send you to the emergency room and possibly be admitted. Self-isolation is the key. When you are diagnosed with COVID-19, please stay home, stay in safe isolation. If you feel you have COVID-19, quarantine yourself, because you do not want to expose the community to further transmission. So again, I want to emphasize, COVID-19 is not a death sentence. We hear all these numbers that people are getting COVID-19. It was initially 50, then 80, then 90, now it's 193. But majority of those people who have positive COVID-19 test results, they're at home self-isolating, and majority of them are doing well. CPS personnel, they're very, very well trained to be checking on you every day to make sure you're self-isolating, and if you need anything, they will provide you with anything you need. So I would appreciate if you follow the recommendation of your doctor as well as the CDC guidelines about how many days you need to isolate yourself or you need to be in quarantine. The CDC guideline, which is Center of Disease Control guidelines, are online, and please follow those. All right. So at this point, I would also give the floor to Dr. Andrew Walker, who is the founder and the co-chairman of the chairman of AMI.
Thank you, Dr. Murkia. The first thing I'd like to say to everybody is that the government of St. Martin have been planning for a long time now to make sure that everybody is kept safe on the island. They've taken every prudent course of action possible, and they have really prepared very well. I'm very proud of the team effort here, the team effort of my staff at AMI, SMMC, and also the government teams. All together, we can make sure that as this virus does affect the island, the impact will be as minimal as possible. But all I can say is thank you, Minister. You've done a wonderful job in preparing the island, and I'm looking forward to this having as least impact as possible. Thank you.
Thank you so much, Dr. Walker. I also have my project manager, Ms. Kim Milliken, who is sitting next to me, and she has been dealing with the entire team since April 8th. Please make some statements.
Again, I want to thank you so much for having us. We are here to make sure that you guys are safe and have the best medical care possible. That's made possible by SMMC, of course, Dr. Walker and my staff. You have all been extremely grateful to have us, and we to have you as well. I just want to thank you, and we'll make sure that we get through this together. Again, let's all make sure that we wear those masks, make sure we have hand hygiene and isolation. That's how we're going to control it on the island, and just take care of each other. And once again, God bless and thank you.
I want to make another point here. So I hear if the hand sanitizers are good enough to keep the hand hygiene intact. The best recommendation I have from you for you, as well as the CDC guidelines, say that hand washing with soap. It doesn't have to be antibacterial soap. Any soap which would basically take away the fatty layer of your skin, and it doesn't have to be scrubbed down for 30 seconds and more, would be able to eliminate the virus of your surface of your hand. Again, hand sanitizer may be a transient good solution, but hand washing with soap and water is the best, greater than 30 seconds. Remember that. And also, do not touch your face, your mouth, your nose if you're outside and you don't know who you have been in contact with. Wear your mask. Now, what kind of mask helps you? All kinds of masks could help you, but the best masks there are actually like Nancy 95 masks are the best barriers to protect you from somebody who is sick. Remember, the mask is always good if the person who is sick wearing it, so they cannot transmit the virus to you, who is the healthy person. So both of you should wear masks, but the person who is sick absolutely has to wear the mask. I hope that answers a few questions, and I will leave the floor open for any other questions coming up.
Thank you, Dr. Walker and Kimberly Millican. I would now like to re-invite the Minister of Public Health, Mr. Richard Panafleck, to address you.
Thank you, Ms. George. Thank you, Dr. Kirash. Thank you, Kimberly, and thank you, Dr. Walker. I would like to extend a thank you to all of the Aspen Medical International team that is being helpful to the St. Martin Medical Center. Thank you, Dr. Holliday, for allowing the time so that they could give a brief comment so that the people could hear from them. I will salute and thank all that are the frontliners that working in this pandemic of COVID-19. I would like to reiterate to the community to adhere to all the protocols that has been sent, to all that what government is doing and telling you it's for your own benefit, it's benefit for you and for your family. As we all heard at that, then we can get back to the St. Martin that we want the soonest. I would like to thank you, God bless you, and continue taking the necessary steps to be safe and yourself healthy. Thank you.
Minister of Public Health, Social Development, and Labor, the Honorable Richard Panafleck, the AMI team, radio listeners, and online viewers. This brings us to the end of this national briefing for today, Monday, August 17, 2020. For rebroadcast, tune into St. Martin Cable TV, channel 115, St. Martin Gov Radio 107.9 FM, the official Facebook page of the Government of St. Martin, and the YouTube channel Government of St. Martin. For video on demand, be sure to log into the official government's website at stmartingov.org. On behalf of the Departments of Communication and the Government of St. Martin, I'm Relika Roach, and wishing you a pleasant Monday further.